Good afternoon, guys. I have discussion B for you. Now we are discussing how to protect a loved one when choosing a nursing home or assisted living facility. Okay. We're going to go through the whole presentation and then people can leave me comments or questions about the show, after the presentation. So here we go. How to protect a loved one when choosing a nursing home or assisted living facility. Introduces practical guidance for families facing a sudden need to find long-term care. The article frames the decision as urgent and emotionally difficult, and it focuses on concrete ways to evaluate facilities so you can reduce risk and choose safer, better staffed options for people. Key points. The surrounding page explains why the choice often happens suddenly. Moves to long-term care commonly follow an acute event, a fall, loss of mobility, memory decline, or the death of a caregiver, which makes quick, informed decisions essential. Start with official ratings for nursing homes. For nursing homes, not all assisted living, the Centers for Medicaid Services, CMS, maintains inspection records and one out of 5-star rating that shows ownership, staff levels, and violations. Use these ratings to rule out the worst options while recognizing their limits. Understand ratings limitations. CMS ratings rely in part on self-reported data, so they can be unreliable. A low rating is a strong red flag, but a high rating isn't a guarantee of excellence. Look beyond the surface impressions. Don't be persuaded only by attractive lobbies or the decor. The article advises inspecting care areas, staffing, and daily routines. Rather than judging a facility by its public spaces. Practical steps the article recommends. Check CMS records and star ratings for nursing homes to identify serious problems and gather basic facts about ownership and staffing. Read inspection reports and online reviews. Find patterns of complaints or violations that the star rating might not fully reveal. Make a short list and visit in person. Observe care routines, staff interactions with residents, and conditions in bedrooms and dining areas, not just the lobby. Consider ownership and nonprofit status. The article notes nonprofits are often better staffed, which can affect quality of care. Quick takeaways to protect your loved one. Use ratings to eliminate the worst choices, but verify details with reports and visits. Prioritize staffing and daily care over aesthetics. Staff availability and how they treat residents are stronger quality signals than decorations. Okay, now we're going to get into protecting loved ones in nursing homes. Safety first. Protecting loved ones in nursing homes signals a practical, safety-focused guide for families choosing or monitoring nursing home care. The surrounding article frames safety as an ongoing responsibility and emphasizes concrete steps for families can take to reduce risk of falls, infections, medication errors, and poor emergency preparedness. Why safety is a central concern. Decisions are often urgent. Moves into long-term care frequently follow a health crisis or loss of a caregiver, so families must screen options quickly but carefully. Staffing is the single biggest safety factor. The article stresses that adequate trained staff determine whether falls and emergencies are prevented or become dangerous. Fall prevention. Most falls happen in residents' rooms. Frequent purposeful monitoring, low beds, non-slip socks, excessive assistive devices, and sensory-friendly spaces can reduce risk. Infection control and emergency preparedness. Nursing homes must have infection prevention plans, and coordinate with public health agencies. Vaccination and visible visitor alerts area are recommended during outbreaks. Medication management, safety or safe homes use electronic medical records tied to pharmacy systems, locked medication carts, and clear verification procedures to prevent timing and dosing errors. Communication and transparency, facilities that proactively share staffing, care plans, and emergency procedures build trust. Hiding information is a major red flag. Practical steps recommended for families. Use federal and investigative records to screen facilities. For nursing homes, consult CMS, care, compare, and inspection reports, independent databases like ProPublica and LTCC can reveal trends. Ask specific staffing questions. Inquire about staff to resident coverage, training, and backup plans for call outs. Visit and observe care areas. Inspect bedrooms, bathrooms, dining rooms, and watch staff resident interactions rather than judging by lobby or decor. Probe medication systems. Ask whether the facility uses EMRs linked to pharmacies, how medication is passed, are supervised, and how time-sensitive drugs are handled. One-page checklist to bring on tours. Check public records. CMS Care compare ProPublica inspection reports. Use nursing home 411. Okay. Okay, staff availability. Observe staff availability. Cleanliness of rooms and bathroom presence of trip hazards. Ask typical staffing ratios. Staff training on falls and transfers. Infection control protocols. How medication timing is ensured. Watch for red flags. Evasive answers. Residents left unattended. Cluttered walkways. Inconsistent communication. Final takeaway, folks, for the show. Treat the headline as a call to prioritize safety over appearance. Use public records to eliminate risky options. Verify staffing and medication systems in person. And insist on transparent communication. Okay. So that is B for you. I'm going to take a little break and I'll be back on with C in a bit. For now, Gator Wellness, take care, folks.